thing that comes from the patient is, I am not happy about my smile. Some are not happy about the color. They say my teeth look yellow. Some say my teeth are crooked. Some say, well, my teeth shape is not right. So targeting the right treatment and going towards the right treatment planning for the patients is very important. So understanding the patient perspective, understanding what they want to achieve, how they want to achieve. So making sure the health and cosmetic is combined together is the way forward. Google tells you a lot, but at the same time, Google distracts you a lot. You have to go to the dentist to have a clear understanding that what the problem is. 3 elements which according to me is the way forward to the cosmetic dentistry is, number 1, you correct the position of your teeth, dwelling towards orthodontics. Orthodontics has enormous amount of options depending on your budget, your lifestyle, and a kind of a person you are. So once the position of the teeth is done, second comes the color, because the color of your teeth need to match with the sclera of your eye. So this is the element of having the white teeth. And third comes the shape that suits you. So having a detailed consultation about all these elements is quite important. It's not something that you try and test on your body. So the teeth whitening has 2 ways. First, most important thing is it should be done from the professional. You can have an in-surgery whitening where the whitening is done by the dentist, or you can have a home whitening kit from the professional again, where you can do the teeth whitening yourself at home.
Can you tell me about oil pulling, and can it really help whiten my teeth?
Well, oil pulling is a very ancient and Ayurvedic way of keeping the teeth healthy. It's a very old practice. What it actually does is, when you use a teaspoon of oil and swish it around your mouth, number 1, oil binds with the plaque layer. So by binding with the plaque layer, it kind of disrupts the layer when you swish it in your mouth. So how it's performed is, you take a teaspoon of oil. The favorite oil in this situation is the coconut oil, because coconut oil is high in content with lauric acid, which has antimicrobial property. So when you do that, do it empty stomach and swish it in the mouth for approximately 15 to 20 minutes and use it regularly. If the question comes about whitening your teeth, it doesn't change the color of your enamel, but it makes your teeth look cleaner by disrupting the layer of plaque.
What are the essential daily habits that can help my teeth be naturally long?
Number first is, we all know, regular brushing. So when you brush your teeth, make sure you brush 2 times and twice a day. So 2 and 2, easy to remember. The second thing is the regular flossing, because in between your teeth, the food particles get caught and you see the staining forming more in between the teeth. You can always try some over-the-counter mouthwashes, which are there for the freshness of breath and keeping your teeth clean. Another thing is the use of tongue cleaner, because sometimes the patients feel, my teeth are not feeling clean. The xylitol-based chewing gums is another remedy, because xylitol is a protein-based sweetener. Avoid having a lot of stain-causing food particles. For instance, if you're having a glass of red wine, if you're a smoker, if you're having tobacco, a lot of black coffee, tea, etc. The most common dental problem, which is faced by generally all age groups, is called as a dental decay or dental cavity. And most of us believe that the cavities can only form by the intake of sugar. But actually, the cavity is a process which happens because of the softening or the demineralization of enamel, where your enamel loses its mineral content. So if you're having the regular intake of water, and if you're having frequent sips of coffee, and if you're having frequent snacking throughout the day, we are diluting the saliva, and we are not giving enough time for the saliva to bring the minerals to the enamel and make it harder. So one habit that we can change in order to prevent cavity formation on our teeth and on children's teeth is to reduce the frequent intake of food or drinks, and that includes water.
Why do some people have really white teeth and some people have yellow teeth?
Well, the color of your tooth is entirely dependent on the structure of the tooth. Our tooth is made primarily of 3 important layers. The outer layer, what we call as enamel. Your enamel is like a glass slab, which is actually translucent. It's not really white in color, but it shields the second layer of your tooth, what we call as dentine, and that is yellow in color. And the third layer, which is the innermost layer of your tooth, which is responsible for the life of your tooth, is called as pulp. As we grow, as our eating habits change, we end up having a lot of wear and tear of enamel. So basically, we are losing the thickness of enamel. If the thickness of enamel is gone, we are reflecting a lot of the second layer, which is a dentine, and hence we feel sometimes my teeth color is changing and it's becoming more and more yellow in color.
So is there any diet I could follow to have white teeth?
Number 1 is the use of crunchy food. Well, crunchy food, for example, apple, you have carrot, and you have celery. These kind of things have a scrubbing action on your teeth, and that really helps in cleaning it. You can have strawberries, because strawberries have malic acid that really helps in keeping your teeth stain-free. Try to avoid the things which can stain your teeth, like tea, coffee, curry, sauces, and these kind of things. Reducing the consumption of tobacco, if you have tobacco, because of course it's the leading cause of oral cancer. So if there are few diet changes or few lifestyle changes we do, we can go a long way, and that of course that helps in maintaining the color of your teeth.
The teeth whitening done by the dentist never disrupts or never harms your enamel, but nowadays there are a lot of other people who are non-medical professionals. They are doing the dental teeth whitening as well, because knowing your enamel is very important, and dentist is the right person to do the teeth whitening. Teeth whitening is for everybody from the age of 16 to 18, because by that time your enamel is fully developed. Well, you should start from a consultation, and as I say, if I give you a roadmap of what to look for, first thing, get your teeth straightened if you want to, and if you feel you're not happy about the position of the teeth. The second, I'll work on the color of the teeth, which is about the teeth whitening. And third, I will go and embark on the teeth shapes, to correct the teeth shapes with the help of veneers or with the help of composite bondings.